Let's go through taping of the nose. Let's have a look here. So we have one layer taping or two layer taping, so I'm going to demonstrate both. The first tape that we'll put is above the tip, called the super tip area, okay? And that's a little over an inch. And then the next layer is slightly over an inch, and it's just above the first tape. And the third tape that we do is close to the top of the bridge, and it is about an inch long. And the fourth tape goes below the tip of the nose in what we call the infratip lobule area, just about here, just above the nostril line, and it goes straight up on the nose, and then we can press it down, squeeze the side of it like this. That's the one layer system. And then if we wanted to apply a two layer taping system in patients with thicker skin or still with persistent swelling, we put a second tape below the nose, about halfway up the last under the nose tape, and we go at a bit of an angle along the side of the nose, and again you can just press that down, and then we apply 3 more tapes over the bridge of the nose, again in the super tip area, a little over an inch, in the middle of the nose, just there, and the final tape goes at the top of the nose, just there. Okay, so that's demonstrating one layer system and a 2 layer system of taping for the nose after rhinoplasty.